Hey, thanks everybody for tuning into today's Medicare Moment. We are going to be looking at one of the most common questions that I get asked on a day-to-day basis, and that is, when should I sign up for my Medicare? In fact, just today, I had a spouse of one of my clients reach out to me and ask that very question: when should I sign up for my Medicare? The good news is they have at least 6 months before they are turning 65, so plenty of time for them to get signed up. But that reminds me of this article that was published yesterday by Emily Brandon. She published it in the US News and World Report Money section. Apparently she's a senior editor there, and I do want to commend her on doing a great job on writing this article. Oftentimes when non-healthcare health insurance professionals are writing about Medicare, they tend to make some mistakes because, as you I'm sure are very well aware, Medicare is super complex. It's very intricate. There's a lot of moving parts, and so while I commend anyone who is trying to get some of that information out, it's just really important to understand where you are getting your information from. But Emily did a great job in this article, and she brings up 7 points, and I just want to walk through those points. These are great points, and as they relate to when you should enroll in Medicare, some questions about enrolling in Medicare and how that relates to Social Security. Just so you know, I am a Medicare health insurance agent. That's what I do full time. I specialize in Medicare plans, helping people make that transition from under 65 health insurance onto Medicare and make sure that that transition happens very smoothly. I am not affiliated or associated by the Medicare federal program. I am an independent insurance agent. So if you do have any questions, feel free to reach out, leave a comment, and I'd be happy to help you with that. But let's go ahead and look at the 7 points that Emily makes in this article. And the first one she says is Social Security and Medicare are separate decisions. And that's true. Now, like I said, I am a health insurance agent, not a financial planning or a Social Security expert. So you will want to talk with someone who deals in those realms as a professional and expert in those areas. But that is true. You do not have to claim your Social Security retirement at the same time that you claim your Medicare. Now, some people choose their Social Security before they choose to enroll in Medicare, and you're perfectly able to do that. So just know that these two decisions are separate, although you do sign up for Medicare through the Social Security Administration, and you can sign up for Medicare and Social Security at the same time. Which leads us to the second point that she makes, that some people are automatically enrolled in Medicare, and that's true. If you are already receiving your Social Security retirement income before you turn 65, you're going to automatically be enrolled in Medicare. So about 3 months before your 65th birthday, Medicare is going to issue your red, white, and blue Medicare card. Now it's going to have both your Part A and your Part B effective dates already signed up. All you have to do, you don't have to do anything actually. But for some people, they choose to defer their Part B enrollment. If you're receiving your Social Security retirement income, you must take at least Part A. Most people get it at no cost, so that's no problem. But some people don't want to keep Part B. We'll talk a little bit about that in a minute. And so if you want to defer your Part B enrollment, just flip that card over, sign the back of the card, send it back to them. They'll send you a new card with only your Part A enrollment effective dates. The third point that she makes is remember to sign up for Medicare on time. And it's true that there is a 7-month window around your 65th birthday. So it's the 3 months before the month you turn 65, the month you turn 65, and the 3 months after. That's your initial enrollment period. You're going to want to sign up for Medicare. Most people, the government even acknowledges that most people should sign up for Medicare Part A and B during their initial enrollment period. Now, I'm going to recommend that you do that about 3 months before the month that you turn 65. That way, if you need to get any supplemental plans, if you need to sign up for a prescription drug plan, a supplement, or a Medicare Advantage, you have plenty of time to get that done. If you sign up during the month you turn 65 or after, just know that your Medicare could be delayed up to 6 months past your 65th birth month. So go ahead and get that done early and you'll be taken care of. Now, the fourth point that Emily makes is beneficiaries who work can avoid the Medicare late enrollment penalty. That's true. So both Medicare Part B and Part D, D as in dog, have late enrollment penalties. So if you do not have what they consider creditable coverage, so for Part B, you must be actively employed and covered by a large group employer health plan. So that means that your employer has more than 20 employees and you have health insurance through that plan, you can defer that Part B enrollment. The reason why you don't want to do that is because Part B has a cost, and if you are actively employed through this large group employer, you may want to keep your group health insurance. You may want to go on Medicare. That's a choice that you get to make at this time. But you never know. You may have some dependents or a spouse who are younger than you, and they're counting on you for that health insurance. So you may want to delay that. But if you have that large group health insurance through active employment, either you or your spouse is actively employed, you can avoid that late enrollment penalty. Now, if you do choose to defer your Part B and you don't pick up a Part D plan, which is your prescription drug plan, you're going to want to talk to your HR person and find out if your health insurance is creditable. So both your Part B, which that's fine, that's not a problem, but your Part D needs to be at least as good as the base Medicare prescription drug plan. So they'll be able to tell you. The question you want to ask is our prescription drug coverage creditable? Okay, so what do we got? 1, 2, 3, 4, 5. The fifth point that she makes, signing up for Medicare after you missed the initial enrollment period can trigger penalties. And so your initial enrollment period, like we said, was right around your 65th birthday, those 7-month period. If you miss that initial enrollment period, you're gonna have to wait till the general enrollment period, which is January, February, and March of each year. So if you don't have Part D coverage during that time, you're gonna get a penalty that you pay for as long as you're on Medicare. If you don't have medical coverage through active employment or Part B coverage, you will get a 10% penalty for every 12-month period that you don't have health insurance and you are over age 65. And you pay those for as long as you're on Medicare. So it really does serve you well to sign up for Medicare as early as possible and make sure you get that taken care of, or work with a professional to make sure that you avoid those penalties. The sixth point that she makes is be prepared to get a bill. Medicare is not free. Now you are paying, as you're working and paying taxes, you do pay into the Medicare Trust Fund. And as I said before, most people get Part A at no cost, but most people who are signing up for Medicare in 2020 pay $144.60 for their Part B. Now, if you don't sign up for your Social Security retirement income, you're going to have to pay that. And Social Security will bill you quarterly, or you can sign up for them to auto draft that monthly. Now, if you do receive your Social Security retirement income, they'll just automatically deduct that Part B premium off your Social Security check. You don't have to worry about it. But just know that if you're not signing up for Social Security at the same time that you're signing up for Medicare, you will be billed and you need to pay that. And you need to make sure that you pay that Part B premium, because it can cancel and then you'll have to wait until that general enrollment period to sign up. I don't think I mentioned that that general enrollment period, you sign up in January through March, but it doesn't go into effect until July 1st of that year. So you would have a substantial period of time where you would not have your Part B medical coverage. So, and the last point, number 7, is don't wait until age 65 to start researching your Medicare options. I can't stress more highly how accurate this statement is. As I've said, you need to sign up 3 months before the month you turn 65 for your Medicare. Gives you plenty of time to make your supplement or your Medicare Advantage enrollment selections. Uh, but what I recommend is somewhere around 6 months before your 65th birthday, go ahead and reach out to a professional insurance agent, someone who is independent. That means that they're not tied just to one insurance carrier, but they can shop the entire market. They can find out which plan is going to serve you best and meet your needs individually. And also, as an independent insurance agent, they can be your agent regardless of what plan you choose. And if you change your insurance plan or your company down the road, you'll maintain that relationship with your independent insurance agent. So once again, my name is Jason Denniston. If you have any questions, go ahead and leave them in the comments or feel free to reach out to me. I hope you have a great day. We'll talk to you soon.